Hi, it's Mari McInerney from Croaky here. Would you two be able to introduce yourselves, please?
So good afternoon, I'm Susie Hooper. I am the Northwest Regional Director for Métis Nation, British Columbia, and I'm also here with Canadian Partners Against Cancer as a Métis advisor.
Thank you.
Yeah, and Tanshe, my name is Katina Pollard. My pronouns are she, her, and I am the Provincial Health and Wellness Manager with Métis Nation, British Columbia. I'm a proud member of the Two Rivers Métis Society in Kamloops, BC, Canada, so British Columbia. And I reside on Treaty 8 territory, which is in northeast BC, on the Sekani, Slavey, Beaver, Denizag, Cree, and Sabre Nations, which is also the chosen home of the Métis Community Society of Kelly Lake.
Fantastic,
Perfect.
thank you.
So if I could add to that too,
Yes,
I am
please.
a proud Métis woman with my roots going back to Manitoba. I reside in the Wet'suwet'en territory, which is northern British Columbia, and chosen home of Tri-River Métis.
Fantastic, thank you. Beautiful introductions. Now, you had a presentation. Who would like to speak to that?
Well, I watched the presentation. I was not in the presentation, but I've worked alongside Katina since because they started the pilot project in the Northwest region, which I reside for the program that Katina spoke to.
And Susie's been instrumental in advocating for the project in the North, has really gone above and beyond to bring awareness to our charter communities on the importance of HPV and cervical cancer screening in the communities. So what we spoke to today was our pilot, MNBC's pilot project known as Cervix Check, and it's really just creating awareness around HPV screening and bringing at-home self-collection devices into the community, into the Métis communities in the North. And it's been transformative for our communities. It's been just amazing to see how we have been reaching the underscreened in our communities and really, empowering women and people with the cervix to self-screen and take it upon themselves to look after their care and put themselves number one first.
And how has it been transformative? What have you done that's
I think
made
it's
the
been a
difference?
huge success story, and I think Katina and the team worked very hard because it was also through a couple of the COVID years, and you had to think outside the box. You had to be innovative. You had to find different ways of reaching people because it was it was an odd time and it was not easiest to get people together. So with the team, Katina looked outside the box and came up with great innovative ways to meet, whether it be at a park or corner store, not really corner store, but like someplace that you wouldn't think that in normal times you wouldn't have done that. But it worked. It's a success story. It's a true success story.
Fantastic.
Yeah, and I would just add the piece that it's been, I would agree, the success of the project, and I think that what's been most valuable is the partnerships that we've developed because of this project. So we've really connected in with friendship centers, we've really connected in with the charter communities and our health authority partners, which has been, we've been able to offer other programs and services and work really, really closely with them to be able to navigate the health system in a really safe way for Métis people outside of Cervix Check.
Fantastic. Was there, you were presenting in the screening thread sessions here today. Did you have any takeaways from what other people are doing?
So I would have to say that I think there were a lot of similarities throughout the presentations today, and I just taking this away, I hope that we just build on the connections that we make, the networking that we do here, and I know that I'm really looking forward to learning and hearing more about cervical cancer screening here in Australia and throughout the globe. So I think that's my biggest takeaway is probably the networking and how we can implement their successes into our programming in British Columbia, Canada.
Thank you. And Susie?
I would say similarities as well, in the same words, like nothing about us without us came up in several sessions, as well as collaborating, working together, sharing our knowledge, and including culture and language in everything we do, and people specific is very important.
So what do you mean about that?
We're not pan-Indigenous like in Canada, so we've got 3 Indigenous peoples that are represented. So we have the Inuit, the First Nations, and the Metis. And we all are Indigenous peoples of Canada, but we are all different, unique Indigenous cultures. So not one hat fits all.
Yeah, fantastic. Now, what's it like to come to a conference like this, working in the cancer field? What does it mean to be able to come together globally? Apart from, I think somebody mentioned what a terrible trip it is.
I found it quite fine, the trip. I wasn't jet lagged much at all. I was very excited to come. I had not been to this part of the world before, but I think it's amazing. I was at WIC in Calgary in 2019, and so the continuation of friendship, of networking is very important, as well as the keynote spoke today on what success, where will we be at in 3 years? We have to keep working. We have to keep working.
Fantastic, Katina.
Yeah, and I think, again, there's just so many lessons we learn at these conferences, and I know that I also attended WIC in Calgary, Alberta, Canada, and I think that there were a lot of stories shared there, lessons shared that we were able to implement in our cervical cancer screening program, and I really am looking forward to continuing on, learning from others, learning from other jurisdictions on how they're implementing this work in a really good way and ensuring, I really love the piece of, nothing without community for communities.
And forgive me if I throw this at you. If you don't want to answer, that's fine, I'll edit it out. But did anything in particular bring you to working in cancer care that you would like to talk about? Or
I mean, we've all been touched with cancer, every single one of us. I kind of jumped in with both feet when my daughter was diagnosed with breast cancer at 37. And so, my journey has been with her, and that's one of the reasons I'm here. And it's a success. She's doing well.
Great, great. That's good to hear. Okay.
Yeah, and I think that my heart is really, has always been working alongside people with their cancer journey. I shared a bit of my background, but I am a clinical nurse by trade, so my experience has been specifically working in both palliative and public health, so a lot of those kind of departments weave together and work really alongside cancer patients, and it's just a beautiful thing to be, to be able to be alongside a person when they're experiencing, from the start of their journey to kind of the end of their journey, however that looks, and it's just, it's really humbling and amazing to be.
Thank you both very much.
I would just like to add that, if your heart feels good with the work that you're doing, you're in the right spot.
And that feels like that?
Yes, it does.
That's fabulous. Thank you.